So I am an occupational therapist. I've been in the field probably going on for about 7, 8 years now. In 2020, I started a mobile practice for adults with disabilities, young and older adults. So I go in and out of people's homes and I work with them with a variety of diagnosis in the New Jersey and Pennsylvania area. Recently, it's been morphing more into neurological conditions and disorders. So that is kind of like how we've kind of collaborated, Life Wellness Occupational Therapy, which is my company, and also with Motus Nova. Well, to be honest with you, I was just getting onto Instagram, and I believe it was someone from Motus Nova. They reached out to me and told me about the product. And when I heard about what it actually could do for my clients, I told them that I was interested in learning more about it and thought it was a fantastic intervention. And so I got trained on it and we started from there. I want to say probably about a quarter of them. I wish more were using it, but and that's what it was important for me last year to actually talk to some of the coordinators over at Motus Nova to see how I can get more involved, because with the patients that I do have, that some of them never had heard of it, because I'm working with patients with it, I really believe that it would benefit them more. So I'm actually hoping for this year to get information out and actually do education and training on the device to see if there's more patients that I know for sure that would benefit, would actually um, be willing to actually have one of their own and rent it, go through the process of being trained on it. So one client in particularly, when I uh, started with him, he had really, really, really bad tone in his entire arm. It was more like really stiff in his chest, and his fist was in a really tight ball, and he was in a lot of pain. Um, the what I loved is the flexor tone reduction stretch, the thermometer game. That we spent a lot of time with. He was in a lot of pain. He was very stiff, a lot of tone. And with that, working with him on that, that's the only thing he could tolerate for months. And I would slowly upgrade him on the intervention until he would tell me consistently that he was about 2 out of 10 pain. So we went from 10 out of 10 to 2 out of 10. And his limb, his left arm, was more relaxed when he was sitting in his chair. From that point on, we started the fine motor, which his favorite was cosmic tennis. So we did fine motor for a few weeks and then on to gross motor. So what I love about this is that it's a comprehensive program where, depending on where the person is, you can upgrade, downgrade, add more time, add more reps, include a variety of functions that the limb should be doing in order to complete their self-care more independently. So it really increases two-handed task in the long run when the limb actually starts to function. I would say it would be great to get anyone to at least work on it 5 to 6 days a week for about an hour a day. If they can tolerate more, maybe up to an hour and a half. What I think is essential, though, is I'm finding that most people are not that disciplined. And so that's where I believe occupational therapy comes in, is that for the people that I see, most people are not that disciplined that I've worked with. So because we see them no less than 3 days a week, they're at least doing it for 3 days a week. We always set up a home exercise program for them to continue on. I haven't figured out why people aren't as consistent as they need to be. And that's what we're trying to promote too. Beyond therapy, they need to continue on throughout the weekend and on their days off so that they can continue to see better improvements faster. I've been really working on talking to the caregivers, spouses, whoever's in the home to help encourage the client to do more, even if it's not like an hour to an hour and a half, like they would do with me. Something is better than nothing, even if it's like a half an hour each day over the weekend, but not to leave it for when they have their next therapy session. It's hard to say what's the biggest value. I can say that people that have neurological conditions, it's a long process in many cases for the person to get rehabilitated, depending on the prognosis, depending on what's actually going on, and if they have a good prognosis where they could possibly get most of their function back, or are we just trying to maintain a decline as long as possible. But what I like about Motus Nova and where I feel like it's added the biggest value is that there's a variety of games and it keeps the patient motivated and encouraged. I find it that they actually get lost in trying to beat a certain score or playing against the game itself. And so while they're having fun playing, they're working on a variety of things, which would be like gross motor, fine motor, precision, reaction time. And I've seen where I've even mixed it up sometimes where maybe if I have fine motor like 1 month, I'll start with gross motor the second month and continue with all the other activities. And I can see sometimes that there's a jump in function just based on how we're reordering these activities. And so I think if a patient is not motivated, it's hard. And I believe Motus Nova and the games that you have keep people motivated so that the outcomes will happen eventually. I believe it was actually made for neurological disorders. So definitely going to stick with, stroke, MS, ALS, cerebral palsy. But I also believe that there are other benefits that's not so neurological, like let's say if somebody's had surgery on their arm or they've just come out of a cast or a carpal tunnel and their limb is weak, or there's tightness because of surgery in the hand and the doctor has just released them for rehab. I do believe that gentle exercises that the Motus Nova device can provide could absolutely help them to recover a lot faster. I mean, generally, the doctor has a protocol and they will say after surgery that when they say that they're ready for rehab, they start the protocol. And so we're doing finger and hand exercises to stretch, whether it was the wrists that needs more extension or the fingers need to relearn how to manipulate or become stronger to grip and grasp, things like that. But it's a doctor that leads the protocol. But when they say there's no precautions, you're good to go, or you can start a gentle stretch, the machine, just even for the flexor tone reduction, depending on how you gauge that machine, it could help with just a really good stretch to start hand therapy. I'm actually hoping for me to get more involved with this because I'm around a lot with between New Jersey and Pennsylvania, and I see where this device can benefit many more people that actually have it. I guess it's something that I want to work alongside with Motus Nova throughout the year to see how we can get this into more hands.